My name is Sharon Deas and I'm the Patient Experience Specialist for Energesse, and welcome to our webinar. Just as a reminder, we're going to use GoToMeeting for this webinar and your microphones will be put on mute while the presentation is ongoing. Please type in any questions or responses in the chat box for Dr. Avi, the presenter, to view, and he will answer them as he goes along. There'll be plenty of time for questions at the end, so if you want to wait until the end to post your questions, that's possible too. I'd like to introduce our presenter for today, Dr. Avi Ratnanason. He's the founder and CEO of Energesse, a firm that specialises in improving patient experience and customer experience in healthcare through consulting, training and survey services. Please welcome Dr. Avi.
Thanks very much, Sharon. Hopefully this is clear for everyone, and welcome everyone to today's Masterclass on how to engage leaders and frontline staff on culture change, which is a topic that many of you over the years have either talked to us about or particularly recently asked for more help on. And as such, based on your feedback, we've developed this for you alongside some recent roundtables that we ran in Sydney as well. So I'd like to also acknowledge the traditional owners of the land for which we stand, and certainly good morning, good afternoon, and good evening to people who are signing in from all around the world, as we often have an international audience. Whilst we're at it, feel free to also introduce yourselves on the chat box, your name and roles, where you come from or which organizations you're working with, just so I know who I'm talking to today as well. That's always nice to know. So moving straight into it, most of you or some of you may or may not be aware that Energesse is an organization that's involved in basically improving patient experience and culture in health organizations. We work with health districts and health services like Western Sydney, Southwest Sydney. Done work with Ramsay and primary health networks. We've become a partner of Apple recently as well. And in addition, we've also worked with the research sector. We've worked with CSIRO, pharmaceutical companies, health insurers, Bupa, NIB, GU Health, IVF, and many other sort of organizations from Australia, UK, US, Malaysia, working in the KPJ group. So we've really got this broad sort of experience in helping improve that patient experience across different organizations in healthcare. And some of my team are here, and I'll talk a bit more about them as we go along. So what do you want to learn today? Well, part of what we're going to talk about today is how to basically engage staff and leaders in improving culture, which sometimes, and it can be quite a qualitative sort of thing, but we're going to talk about how that can actually be measured and how we improve that. So some of you may be in a role where you're just starting in a new organization, a new place, and you're trying to figure out the environment and the culture of where you work, where others may already be quite advanced. You've improved things in the space, but you find that culture is holding you back from making more improvements in your either your team, your organization, your department, and you're trying to figure out how can I actually make the improvements or action changes in light of the culture that I'm working in, and healthcare particularly is quite a specific culture. So we'll talk a lot about that. Now, culture is something that's been documented, talked about in management literature for ages, and this is a very famous quote: "Culture eats strategy for breakfast," by Peter Drucker, one of the management gurus. What did he mean by that? Well, it essentially means that many of us are very good at putting together plans, projects, initiatives, writing up these wonderful documents about how we're going to change the world, or at the very least create some kind of improvement in our sort of team, organization, or department. Say it's a hospital or so on. But then the culture, the people, the behavior of the people in that organization then stops it from happening, and you can't seem to overcome this kind of emotional sensitivities that are going on with people all around you. And so that's the whole point, that whatever strategy or implementation or program or project or improvement that you want to put in place, you can be held back by the behavior of people all around you in the workplace. And that's what Peter Drucker meant by culture eats strategy for breakfast. But here's the thing. I'd like to add another point to that is many people, when they say, oh, I can't improve something, it's the culture of my organization. The first thing you've got to get clear on is, what is that specific objective that you're trying to improve, right? And what I find is that often the person, the change champion, the person trying to drive improvement, this might be you, is not actually very, very clear on a specific metric or a specific behavior or a specific objective that you want to achieve, right? And so we can sometimes be very generic that the culture is out of place, but we're not very clear, we don't have that clarity on what the specific objective of improvement is. Because when you get very, very clear and very specific on what you want to improve, you can find that the pieces that you need to put in place in order to create that improvement can overcome any cultural barrier that you might perceive is occurring. And so if we look at, what are some of the objectives out there in health systems at the moment, certainly the Institute of Healthcare Improvement advocates for the healthcare triple aims. Some of you have heard of healthcare triple aims, which is to either improve patient experience, health outcomes of patients or population health, and also improve value. So that is either achieving some kind of cost saving, or for the private sector, it's often growing revenue. And value is really revenue over cost. But also, the Bodenheimer in his writings also talks about, well, if you want to do all of that, triple aims, it's also important to make sure that the staff experience, the clinician experience, all these elements of culture also align with that, and you're looking after some of that. And I'll talk to that in a minute as well. And you've seen that, these sort of objectives in health systems have then driven a lot of movements, I would call it, movements towards person-centered care or personalized health, movements towards value-based care, and there's lots of programs even in New South Wales here in value-based care. If you're creating some kind of IT project, you're certainly looking at benefits realization from the IT project. Have we created some efficiency, reduce cost, or improve revenue for the organization? You would have seen movements around integrated care. That is, how can we improve services for patients as they go through primary care from the GP right up to hospital, and looking at that whole population health. That's very driven towards health outcomes. And then, you've seen some projects and movements around workforce optimization. So looking at how can we make things more efficient for the workforce so we can see greater volumes of patients, but also understand that intangible piece around culture. And I'll talk a bit about how we can make the intangible tangible moving forward. Here's one of the ways, of a very famous sort of tool from Johnson and Scholes around culture. It's called the cultural web, and it covers about 6 different or 7 different sort of paradigms of elements of culture. One aspect of culture is stories. So what are the stories and what are the gossip that you're hearing on a day-to-day basis? I call it gossip because that's sometimes what we refer to it. But what are the stories that patients are telling you? What are the stories that you're hearing from your colleagues by the water cooler, on a day-to-day basis? What are the success, the failures, the dramas, what's coming out in the newspapers? All these are stories that reinforce the culture in your organization. Then there's the symbols, right? So some organizations have got more open plans, so it's producing this culture of openness. Some have, a co-location of specialists in one area, or specialties like cardiology, gastroenterology. Do certain specialists have car parking spaces that are more hierarchical and more VIP car parking, or is it all? Is everyone got equal slather? That are all those symbols. Then tell you a bit more about how your culture is organized. Then there's power, obviously, which is, there are obviously some people who've got power because of their status, whether they're CEO, C-level, or so on. But there's other kinds of power. There's influence power. There's some people are married to other people, and therefore have got relationship power and influence. These are all the realities that then exist within and shape the culture. Then there's the shape of the organization. Is it more informal? So you find like in small businesses, startups in healthcare, it's more it can be more informal, whilst and based more around a network structure. And I'll talk a bit more later about how hierarchies and networks, how you can use hierarchies and networks to actually shift culture in your team or department. Then there's the control piece, which is all around the regulations, the policies that sit within your hospital or your clinic. You know, how do you actually change those policies, and how do they control the financial side of things, but also what you can or can't put out in your hospital. So very recently we tried to put out an article about a certain project that we've done, but it got stopped by certain sort of communication protocols, and we couldn't sort of put it out there. And so there's certain controls put in place around communication, governance that exist within your organization. And I want you to recognize that all of these things are part of culture, right? Sometimes you just talk about people's behavior, but all these other pieces form part of culture. The other thing that's part of culture is also rituals. So how often are you having huddles? How often are you doing a 360 performance review? How often do you go to training? All those pieces form part of culture. And that paradigm, that culture paradigm, sits in the middle, which actually then is the composite of all these different elements. So when you're talking about culture, and culture is holding me back, culture is preventing me from doing something, which of these pieces is part of that culture, but also now you should be consciously aware that these are some of the elements that you can shift in order to change culture and create improvements within your organization. So we're going to get into some specifics in a second, but here's one case study of Dr. Kate Granger, who is actually a doctor from Mid Yorkshire National Health Service in the UK. And her issue, or rather her story, was around, she was a doctor, but she actually suffered from cancer. And during a time becoming a patient, and a patient with cancer, one of the things she realized when she was under care was that she was getting good clinical care, but people weren't really introducing themselves to her when they were coming up to her and looking after her. And she was actually shocked by how much this actually distressed her when doctors, nurses were coming and giving her advice and laying their hands on her, and she didn't know who they were. But that was the environment that she had been working in all that time. And so when she got better, and she's passed on now, but she started this campaign, which became hugely successful, this movement called Hello, My Name Is. And it was all about, introducing yourself by saying, hello, my name is Kate, or so on, and I'm the doctor on call today, or I'm the nurse on call today, I'm the nurse on the gastroenterology ward today. And just doing that, smiling, and also smiling, right? So smiling and introduction. Now, this movement that she started went viral and went across the UK health system. It went global. And this just came from an intention of one person to change culture in that organization. So sometimes we underestimate the power that we can create, or as a role model for change. And it went much greater than what she expected. So I think one of the key things is for you to understand that you too can create change and be a symbol or role model for culture change as well, and that we tend to underestimate the sort of the impact that we can make in our organizations. So what are some of the things that we found as practical sort of success factors for improving culture? One of the key things we found is leadership. So the ability for leaders to affect change. The other thing that we found, or other aspect or element around culture, which we sort of underestimate, is the mental health and well-being of our staff. The third thing is around having these patient-centered skills and capabilities. And why I say patient-centered is because many of you I know are very driven towards that person-centered care. So that's a key skill. The other one is reward and recognition, forms a very strong basis of culture. The fifth piece is around empathy and compassion. So how empathetic are you in your communication? The sixth piece that we're going to talk about also is around how do you measure culture, and how do you close that feedback loop to create improvement within your organization. So these are 6 elements that we've certainly seen and recognized. They're all substantiated in the literature as well as in the work we do, and we'll go into a bit more deep dive around it. So just right now, if you'd like to, just type into what's your main challenge in your organization at the moment. Just going back to this, just type in 1, 2, 3, 4, 5, or 6. Where do you think your team or your department or you yourself struggle with in terms of culture? Which of these elements do you find is one of the kind of main priorities affecting you, your team, your organization? So Rosie's put in number 6, so having some measurement around culture and closing the feedback loop. Please feel free to type in as well if you've got an area of priority for you that affects your culture. So let's look into all of these in detail. And as I said earlier, a few months ago, probably around June, I think it was, we ran a roundtable with the Energesse, with the Beryl Institute, which is a leading global institute in patient experience. We ran it in Western Sydney, and it was very successful. We had some great roundtables. We had some great discussions at the roundtables, and a lot of the solutions that we're going to talk about today came out of those discussions, as well as from the literature and case studies that we've come across over the recent months as well. So there's all sort of pretty recent sort of information, and I'm looking forward to sharing them with you today as well. So one of the challenges, we're going to talk about some of the challenges that came up in those roundtables, but also in the literature around, firstly, how do I actually engage leader in this sort of patient-centered change as well? And what are some of the challenges that they sort of face? So starting on the far right, certainly some of the areas that leaders play a big role in culture and shaping culture. How they walk, how they talk, what they say plays a big role. But certainly and so some of the challenges that staff have reported that they find is sometimes they don't get great role models, and they don't get a lot of support from leaders in making that sort of patient-centered change. Sometimes they find that leaders don't have the right vision around change. So some of the comments that came up from the roundtables were, why fix something if it's not broken? We've tried the solution before, we've been there, done that, and it doesn't work. Other comments came up was that we don't know why our leaders make some of the decisions. There's no transparency, and therefore it's affecting the culture in my team or my unit. Another challenge is vice versa. We don't recognize or reward our leaders for supporting the culture that we want to change. I remember when I was I worked at Pfizer, Pfizer Australia, which is a pharmaceutical company, about 10 years ago. And one of the things that was an objective for me at the time was to drive Lean Six Sigma as part of process improvements, but also as part of the culture change in the organization. So it was really trying to drive more quality improvement in various different divisions, from marketing to manufacturing to various sort of organizations. And having read through the literature and successful case studies, one of the things that we recognized when doing these sort of Six Sigma type lean trainings was that you've got to bring your leader on board pretty quick, because otherwise you're just training people and nothing actually happens afterwards. The teams that we were training, they weren't going on and actually implementing the tools. So one of the things that we did was actually got the CEO of the organization to come into the training pretty early on, and also worked with the CEO to help him drive and create his own process improvement or yellow belt Six Sigma, Lean Six Sigma project, which resulted in improvement within his process. And after that project, what we did was we actually created a board, sort of like a league, I wouldn't call it a league table, but literally a recognition board of every person that have actually completed their Lean Six Sigma project. And what we did was we actually put that board up right next to reception, so that every person walking in the organization would see that board of yellow belt champions, and see the CEO's name up there and saying, wow, not only are we recognizing the people that are embracing that culture change, but the CEO is on board as well. So it's really important that whatever change that you're trying to make within the culture, you get your leader, or you make sure that you can recognize your leader and bring them on board as well. Now, in some cases, you might be that leader as well, and I no doubt you are, because you're on this call. So leadership doesn't mean just hierarchical leadership. It also means just being a champion as well. And obviously, some people mention that their leaders don't motivate or inspire them, and that's something that can be worked on, and I'll talk about. So how do we solve this? Well, in terms of making a patient-centered change, some of the solutions that were proposed at these roundtables was particularly in terms of vision and creating a vision for patient-centered care or improved patient experience. Certainly having consumer reps or committees to support the strategy and speaking to the leaders on a regular basis can help. But also having a KPI around patient experience or patient-centered care, or around efficiency or Six Sigma, whatever culture we want to improve, ensuring that those KPIs sit alongside other key performance indicators, like your finance key performance indicators or length of stay key performance indicators, having that up on dashboards at tier 1, tier 2, tier 3 levels of management, right up to C-level executives. Making sure that's all visualized is really, really important to get the leaders engaged. The other piece is around, if you're involved in recruitment, ensuring that that patient-centered behavior is in those leaders' job descriptions, so that they walk the talk, and coaching them from time to time around, your behavior the other day in that meeting didn't quite represent the empathy that we want to show in our organization, doesn't quite represent the culture. And certainly in some of the clients and hospitals that we've worked with, we've seen managers coach directors on this. If they've seen directors perform in this way, or be quite rude at meetings, they've actually gone in like literally straight away on the next day and actually coach that particular director or CEO and said, hey, your behavior the other day, it wasn't really supportive of what we want to see in the team. You were quite rude to this person. And certainly I've done that myself in the past, and people will tend to respect you more for it if you put it in a way that doesn't particularly offend them, but actually explains that you're also trying to achieve the same objectives that they are in that conversation. The other piece that you can do is also transparency. So making sure that any vision or goal around patient-centered care, or any challenge that you want to highlight, is quite transparent. There's a saying, sunlight is the best disinfectant. So the more transparent you make your results, your goals, your challenges, the more people will understand or try and help you along that as well. One of the other pieces around leadership and coaching is our technique for coaching is to actually you use these 3 key questions, and they came up, is what do you think we can do about this kind of experience? So if patients are coming to you and saying we're having a poor experience on, say, the outpatients clinic, for example, and they're waiting a long time, it's really important to talk to your leaders and say, well, what do you think we can do about this kind of experience? What other information do we need to provide, and what help do you need in order for me to actually improve the experience? So having these 3 key questions as part of your conversation are good coaching questions as well. Finally, of course, motivating and rewarding staff is really important. But how do you motivate that? One of the good ways is when you're getting positive feedback from staff or from consumers or patients, sharing that positive feedback with staff, either in huddles or handovers, is a really good technique. Now, one of the things that sometimes I hear people say, oh, yes, I do that. I share positive feedback and every now and again. My question back to you is, how often are you doing it? Are you doing it daily? Are you doing it weekly? Or are you just doing it once every 2 weeks or once a month? You should be doing it daily, right? We don't appreciate it, people, enough in general. In general, we do not appreciate people enough. So no matter how frequently you think you're doing it, most studies show that by and large, employees are underappreciated, by and large. right? And there's also techniques. One of the techniques from Sean Aker, you read his book around daily appreciation, is sending daily appreciation emails. So just taking 2 minutes every morning to send an appreciation email to other staff members, right, for something that they have done. And I remember this technique when I read it. I started doing it for a few days, and I've certainly not done it for the last sort of 6 weeks, I'm sure. But this technique, if you repeat it daily, has shown to improve performance over a 6-month period, combined with a few other techniques. So just 2 minutes every day, sending a daily appreciation email to other staff members for maybe some positive feedback or something they've done, is actually proven, if you do it consistently, to improve performance. Now, a case study here is in the Harvard Business Review, the Cleveland Clinic. Many of you will know this. You can look this one up. Healthcare Service Fanatics is an article written about the Cleveland Clinic, where they actually had a very long reputation for medical excellence and cost control. But in 2009, the CEO, Delos Cosgrove, performance relative to other hospitals, and found that, you know, their inpatient experience was actually quite poor. When it came to medical centers and so on, they weren't actually performing very well. And what they decided to do was to try and initiate a turnaround and make patient experience a real leadership priority. And so what they decided to do was, what he decided to do at the time in terms of changing culture was, first, if patient experience was a priority, make it a leadership priority. Communicate to the leadership that this is a priority. He also started to change recruitment processes and bring on new leadership that were more aligned to the culture, and he also put in place key performance indicators were aligned to the culture that he wanted to achieve. The other thing we did was make performance data timely and transparent. So this is one of the things for you to think about. What is the performance data that we currently have, and how can I make that more transparent and more timely? Can I put that up on dashboards? Can I put that up as posters in the clinics or the wards that I work in terms of those patient experience KPIs? How can I make that more timely and transparent? The other thing also is to bring on board your physicians to recognize patient experience. So one of the things you could do is find a physician or a clinician, this is an American term obviously, but find a doctor in the unit that's also already passionate about the culture change that you want to bring, and get them to voice that in various different meetings and so on as well. Now, by doing all these changes, Cleveland Clinic actually found that their efficiency improved and their costs were maintained, but they also rose in national rankings in terms of their patient experience scores. So the culture that Delos Cosgrove wanted to bring, by implementing some specific actions, that culture actually changed, right? So here's what I want to talk about is just get specific around some of the strategies that you want to put in place. And if you keep repeating them over a period of time, the culture will change, right? What is health workforce culture like? Well, many of you work in this space, and you might recognize that there's a lot of high demands, right? That people are very busy. There's many patients to see. There can sometimes be a lot of resource constraints. People are fatigued or burnt out. At the same time, we're being told we need to use evidence-based medicine or evidence-based practice, and we've got to really be very stringent about the science that we use whenever we're treating patients and so on. At the same time, some people can be quite defensive around feedback, and sometimes when you're trying to implement improvement and you're saying to people that, you know, patients have said that, you know, you were rude the other day, or a colleague has mentioned that, you know, you didn't really explain things in a way that they could understand. They might get quite defensive. They might get quite angry, and that can happen quite a bit. On the flip side, there's quite a bit of apathy out there as well. This phenomenon called learned helplessness in culture, where it is actually documented, whereby, you know, a lot of people in middle management say, oh, well, I can't do anything about improving care or improving performance because, you know, I'm just middle management, or I'm just a nurse, or I'm just a doctor, I'm not in management, so I can't really do anything about that. That's just the way things work around here. That's what learned helplessness is, and we need to kind of overcome that if we are going to really change culture. Sometimes also when we're trying to improve experience in a certain environment. Sometimes you might have perhaps certain clinicians, just in some cases, saying, look, my priority is improving the outcomes, the clinical outcomes. I don't really care about the experience. That has happened a few times, and I certainly had one CEO of an oncology sort of hospital say to me, look, Avi, it's been quite difficult here because some of my oncologists say to me, I treat the tumor. I shouldn't say some, but one said to them, my job is to treat the tumor, not the patient. And that was certainly something that, is a real anecdote that I can share. Sometimes also we prioritize the outcomes sort of over cost, and so I was talking to a bunch of CEOs, CFOs, the other chief financial officers at the CPA, and some of their improvements that they were trying to make in terms of efficiency, they were coming at it from an angle whereby some of the clinicians were sort of giving them feedback saying, you're just cost cutting, you don't really care about patients, right? And that kind of be the counter side of things as well. So it was really important to, when you're positioning a change, to say, what's in it for me. And we're all struggling with this whole area of well-being and burnout as well. So there's a lot of data to show about 16% of all inpatient episodes in Australia led to a harmful adverse event. So adverse events are common in hospitals, and it's because it's very complex. Care is busy, many people are overworked, but we also find that there are correlations between well-being as well as burnout and patient safety. So in this systematic meta-analysis done by the University of Leeds by Hall et al., 16 out of 27 studies found a correlation between well-being and patient safety, and 21 out of 30 studies that measured burnout found a significant association between burnout and patient safety. So this whole element of culture in healthcare is tied to mental health. It is tied to if we're fatigued and burnt out. We need to look after our staff in order to shift culture. And that's one of the key points here. And so in some of the workshops that we did, some of the feedback was this, sometimes if we say we're being burnt out, there's this fear that we're not performing. And so people don't want to disclose that they're burnt out. Certainly some doctors have said to me that, if they disclose that they're being burnt out or have a mental health issue, then they get reported to the board, to the medical board, and this is something they didn't want. And so we tend to hide some of these things. Other elements is just this lack of awareness around self-care. So the culture sometimes around healthcare is that we don't actually know how to look after ourselves, even though we've studied it year after year. We know it mentally, but emotionally we don't actually know how to look after ourselves. And sometimes we don't have a role model of self-care as well. The Beyond Blue study that showed that about 40% of doctors have mental health, either depression, symptoms of mental health issues, and that included medical students as well. So it happens at a very young age, and I've spoken to many professors in this area around how we improve self-care and well-being and that effect on culture. And some people say they don't have support in their roles, and it's a systemic issue, but certainly there's that self-awareness issue and your own ability to look after your own mental health. And this came out in a story. When I was at the Beryl Institute, I was one of the physician subcommittees, and sitting on the subcommittees, I was sitting on a table where there was a young junior doctor that kind of raised his hand to the facilitator, and he raised his hand and he said, I'm 4 years into the job. I'm 4 years into being a doctor, and I really love my job, and I want to keep doing it. But when I look at all the doctors around me, this is a hospital in the US, he said, I don't want to be like any of them. They're all tired. They're all burnt out. They don't seem to enjoy their jobs very much. What can I do? And this was, it was stunned silence in the room for a while. And because this was a real person, a real case. And a doctor on the other side of the table who was, much older, and it was really interesting to see. And he is a surgeon in another hospital in the US, and he spoke up and he said, look, I used to be that doctor. I used to be that doctor that was burnt out. I used to be that doctor that didn't enjoy my job only 2 years ago. And I had to really look at myself, and I really had to look at, how do I change? Because I wasn't giving good care to patients as well. I was doing lots and lots of operations every day, but I just couldn't, I just didn't enjoy my job. I just couldn't connect with the job. And he said, I had to learn 4 things. And these are the 4 things that I learned. Number 1, I learned mindfulness. So I learned how to be more present to the person in front of me every day and take time out for myself every day. Second thing he learned was appreciation, and he appreciated his colleagues on a daily basis. The third thing he did was recognize feelings. So he learned how to recognize emotions in other patients and respond to their emotions as well. And the fourth one we'll talk about here, which is some of the solutions that have come from these sort of breakout groups, which is around having a coach. This is really important. I find a lot of people really need coach. Organizations have employee assistance programs. These things help culture. They do help culture, because when you have problems, you can go to your manager, you can go to a coach, or you can go to an EAP program and seek assistance. The other piece is having that frequent measurement of staff experience. I mentioned earlier having those ward tidy rounds or huddles or team talks to share problems. So scheduling team talks where you can share whatever issue or trauma or debrief a particular incident, whether that's an adverse incident or a safety incident, and debrief that, or as a team talk, has shown to improve things. I talked about mindfulness either at huddles or you actually just taking 5 minutes from your work, even whether that's just going to the toilet and having a quiet space, or going out to the grass or the garden or some quiet space during the day when things are really busy, to help you manage your emotions is really, really important. Some organizations have nominated well-being champions within every team, and that's an idea that you could potentially take back, where these people actually look at the well-being of their team and either introduce some exercise routine or introduce some music during the day, or introduce some technique to actually promote self-care within the organization. And there's always somebody passionate about these sorts of things. And then I've talked about, rewarding and recognizing people that have overcome burnout as a solution as well. So here's the one of the things to recognize is the human factors when you in your workplace, which is when you actually want to change culture, or when you want to accelerate it. It's really important to actually look at the emotion of the person you're dealing with, right? When you're talking about, let's say you want to improve patient experience or consumer engagement, and you've introduced a new measure around that, you might see some people having this anxiety. Oh, geez, I don't know what that really means. Or some people even in denial, saying, oh, I just won't embrace it for a while and it'll all go away. Some people have a strong emotional reaction. Some people actually have a lot of fear and then go, oh, geez, how is this going to affect me? It's another KPI or another performance metric. I'm really worried about that. Some people move into acceptance really quick, and then they realize what they can do because you've given them some of the solutions that I've talked about. And some then become energized and motivated to create. Others really have grown in this space. So one of the things for you to figure out is, where do you sit on this curve? What's your where do you sit in this whole curve at the moment? And your closest colleagues, where did they sit in the cultural change that in improvement that you're trying to make? Where is their emotion at? And you want to get them to hear that point of realizing and then energized and motivated in this space as well. Now, a few of you, I can see David and also Tracy mentioned that patient-centered skills and capabilities as well as feedback loops are areas of challenge in your culture. And certainly others have also commented this whole concept of working from ground zero. Like, I'm literally starting from scratch with my team or my department. Nobody knows anything about improving patient experience. What do I do? Some people say we're just focused on complaints in the moment, it's all negative. Others say, oh, we're just doing consumer engagement as a tokenistic exercise. Is it really tokenistic or is it really genuine? And some people have said, oh, look, we've got a real lack of action when sharing feedback. You know, the feedback comes to us, we're collecting it, but then we don't do anything, or we don't know what to do anything. And some of it is also challenges. You know, to what degree of investment is your leader, your manager, your sort of director in making those improvements as well. And I think, you know, one of the key things is around all these challenges is don't give up. It sounds very glib, but just having persistence and repeating this, you know, from days to weeks to months to years. You know, Energesse is now 6 years old, and I've been doing this for 6 years. Change does happen, but you have to be very persistent over time. And now is as good a time as any where I'm seeing some real shifts occurring in our health system. There's certainly some of the solutions from the group. When it comes to things like, you know, if I'm starting from scratch, what do I do? Well, one of the things for you to do is to start learning about co-design principles. And that is, you know, asking consumers how, where, and when they want to be engaged. So people coming through your ward, just asking them, how often would you like to talk to us? How often would you like to give us feedback? Collecting some feedback and training staff on your wards, department, and team on some of these principles as well has shown to create some real improvement. So using that co-design approach, and there's various levels of sophistication around human-centered co-design, co-creation, and I can talk more about that on another webinar. But for now, that's just a principle to think about using as well. When we're talking about how genuine we are around improving patient-centered care or so on, one of the key solutions around that is having a very clear communication plans to emphasize to patients that you can have a say, and also understand the why for staff is really, really important. So when you're trying to introduce a new change, to change culture, let's say you're trying to introduce an initiative around patient-centered care or a quality improvement project, it's really, really important when you have conversations with staff, ask them, why is this important for you? If we make this improvement, why is it important for you? And if you get blank stares, then you've got a bit of work to do, right? It's really important for you to understand the what's in it for me. What is the benefit of them introducing this new project or initiative that you're trying to drive, right? Because if you haven't really got that from them, particularly those people who are influential on the wards and the units, and you haven't really had that conversation, that change is unlikely to occur. That improvement's unlikely to occur, or it might occur in fits and starts, but it won't be sustained. So it's really important to understand from the other person's perspective, why is this important for them? In terms of empowerment, you know, you really need a real role model. We've talked a bit about that around how to get role models and staff, but also in terms of, you know, creating that patient-centered care. It's really important to balance complaints versus compliments and comments. So don't always give people negative feedback. You should be giving them positive feedback on a regular basis as well. And so some best practice that I've seen is this kind of 2-to-1 or 3-to-1 ratio, is where you're giving people positive feedback 3 times for every 1 piece of negative feedback that you give them, right? And that is apparently helps with sort of improved behavior change. I say apparently because we've studied this, it's in the literature, but I haven't used this technique myself in terms of specifically measuring 3-to-1, although we certainly have seen that leaders that get stronger impact tend to be very positive people, and they tend to look for the positive in individuals, and they're more successful to drive change in a more sustainable fashion. There are other leaders, and I won't talk about certain presidents of the United States, for example, that tend to use fear and anger, but I think that approach is not a sustainable approach long term. It's not sustainable for your own well-being or generating long-term cultural change. But that's just my opinion. There are methodologies to improve patient experience. Some of you may have learned about our 6E framework. You can Google this. I won't go through it in detail today, but it's all around how you measure, analyze emotions, engage staff, execute solutions, and so on. But certainly some case studies. For example, we worked at a specialist clinic whereby this particular kind of group of clinics were looking to become the provider of choice in terms of their specialty group, and they realized that they actually needed to identify the skills gaps within the organization. So we actually ran a what we call that 6E training program in their department, and what we did was make sure that the staff were really bought into why the change, this whole cultural change around becoming the provider of choice in that specialist category, because that's a real big step, and you need your staff to buy into that. So we ran a whole series of workshops to engage staff. We talked a lot about sort of empathy, emotional intelligence, so understanding and reading other people's emotions, as well as understanding your own emotions and dealing with that. And we gave them some tricks around self-care, which is, again, coming back to that mindfulness, taking time out every day to rest for yourself, or when dealing with difficult patients, for example, just stepping away, listening to some music, sharing an anecdote with colleague just to vent your frustration. A lot of these techniques, or even going for a dance, believe it or not, some people, moving your body tends to, this is proven by neuroscience, when you move your body after a stressful episode, you tend to release that stress and that amygdala hijack that's occurred in your brain as a result of that stressful episode. So movement tends to release that, either going for a walk or going for a dance or something like that. Shaking your body can release that stress. So all these things sound really simple, but when groups of people on your teams, your wards, your departments do it in their own time, that you can actually see that culture actually shift. And certainly in this clinic, the first 12 months, they saw a 15% improvement in their net promoter score and overall satisfaction with the doctors, just using, this was some of the techniques that were used there as well. Now, this is another case study whereby another group of clinics, this is the Bagan Specialist Center in Malaysia. They went through the 6E training program, and their culture over there was, they wanted to shift to become more centered and have more capabilities in the space. And the 6E model, taught them a whole series of capabilities whereby when they said, what can we improve? They actually surveyed their patients first to see what could be improved in their hospital. And interestingly enough, at the time, the hospital was undergoing a major renovation and the cafeteria was closed. And one of the feedback that came back from patients was that, it might seem really obvious, but there was nowhere to get food, right? So there's nowhere. So patients were waiting for hours and hours and hours, but it wasn't just a waiting time. They were actually hungry. They were really hungry because there was nowhere to get food. So they actually, in creating the solution, the staff, the staff, the patient experience teams doing the survey, actually then worked together with dietitians, the staff from the cafeteria that had closed down, to try and figure out a solution. And one of the really interesting things is using that 6E model, they actually learned to use some creativity to actually take one of these trolleys that was lying around in the hospital that was unused, and converted that into a food trolley. And this became a mobile food cart, which they painted, stocked it with food, and they actually then brought the food to people in the waiting rooms. And because it was a mobile cart, they could take it into the lifts around the hospital and bring it to patients on different wards, and increase the frequency of serving food for patients, family members, and so on as well, which is a real transformation. And they actually measured again just 2 quarters later to see if there was actually any improvement in frustration, and of course that feedback actually improved. So having the skills like this to create solutions that don't cost a lot of money, and this actually made them some money because they were able to sell food again and gain some revenue. It doesn't take that much work to create that culture change. So one of the things that, when you look at that organizational change curve, which is kind of similar, when you think about, as you become aware of more patient-centered techniques and you're trying to create this positive perception, start by experimenting. Point 5 there, experiment with different solutions and measure over time to see if improvement has occurred, because that will actually give you evidence and more data to then convince other people in your teams and organizations around how to broaden that change. So don't be afraid to experiment. You don't have to know what the exact answer is. And hopefully I've given you some ideas here around that. Certainly one of the things that have worked is rewarding and recognize people. So if you spot someone that's delivering that kind of patient-centered behavior. They've either been particularly kind, or they've created an act where a patient has said, thank you very much. It could be a small act of kindness. It could be that, you know, someone in their own time, a nurse in her own time, goes around and just, you know, fluffs up pillows on the wards, or does something above and beyond the usual daily care. If you spot that, go out and celebrate that, and then write about it and put it up on the wards, put it up on your, give it to your communications team, get them to send it out on newsletters and so on, so that these behaviors are strongly encouraged and you're known for rewarding and recognizing people. Sometimes also, if you don't have the incentives to do that, if it's not in the objectives and the KPIs of frontline staff, then it can't happen. So I've talked a bit about the appreciation techniques, and this is really relevant, but certainly some organizations have created awards, either Gold Star Awards. Certainly in Western Sydney, where we'd work, they created a Patient Experience Superstar Award, and this was an award that initially, believe it or not, went to the cleaners. They were the first to actually receive the award, because what had happened was, as when they started introducing real-time feedback and measuring feedback in the hospitals, one of the feedback, or where they were scoring low, was one particular set of toilets on a particular floor were particularly dirty, and they were scoring red. The scores were very low, and the cleaners actually looked at it, actioned it, and increase the frequency of cleaning from 3 times a day to 5 times a day on that particular unit. And we saw that actually score turn from red to green. So, you know, it was a real difference maker from that point of view. So think about, you know, how you can actually celebrate staff. Empathy and compassion I already talked about, but it's really about motivating your hearts and minds and the feelings of the people. And so always try and think about, if you're trying to introduce a cultural change, what's in it for me, for your colleague to change the outcome? And don't assume you know what's in it for them. You've got to go and ask, hey, if we make this change, if we make this improvement, if we increase the frequency of cleaning in the toilets, what's in it for you as a cleaner? What's in it for you as a staff member as well? Measurement and transparency. So this is a case study from the Sydney Children's Hospital as well. And you know, over there, Glenn Farrow shared his slides. He's the Director of Clinical Governance, and this was presented at the IHI BMJ conference. And, you know, he presented a whole case study around how he saved, well, he worked with his organization in clinical governance over a 7-year period and saved $43 million. And we asked him, how did he do it? And he talked about the need to measure it. You need to measure it. You've got to have leadership, and you've got to have transparency around the scores as well, because only 7% of employees truly understand business strategies. And I said, when they looked at medical legal events at Sydney Children's Hospital around 2009, 2010, they managed to reduce that significantly between that period and 2007. So it's a dramatic reduction in medical legal events. And some of the things that they put in place was particularly around using things like, you know, having a clear strategy, measuring, using the balanced scorecard approach. But particularly one of the things around how we change culture was looking at not just the hierarchy, because books like, you know, written by John Cotter around accelerate, how do you accelerate change and culture change, is not just looking at who's your boss and who are the people below you, but who are the people around you, the networks of people. You know, so if you're on a ward, for example, the networks of people could be the catering staff, it could be the cleaners, it could be the admin staff. All these people are very, very important in shifting culture organization as well. So it's really important that you think about the networks. And he actually changed the structure in his organization in clinical governance to have network managers within the organization to improve patient safety. And that was part of the whole big savings that they achieve as well. We've got some tools. In the interest of time, I'm going to skim through that. One's a patient experience maturity evaluation. There's also, you know, other case studies here where if you have changed culture, it is measurable. You would be able to see a change in outcomes over time as well. And this is a case study from Hertfordshire where they actually measured areas where patients had said they weren't performing well, and then introduce specific actions and saw improvement over a period of time as well. So I'm going to finish off because there's only 5 minutes left, but talk about, there are tools out there to measure culture and experience. The text analytics tools that now measure patient feedback measure staff feedback and staff experience feedback as well around quality of service, stress, tiredness, where it's coming from, just a specific free text about where it's coming from the staff levels as well, and codifying it as well, which actually helps you measure culture, not just from a quantitative perspective, but from a qualitative perspective as well. So we've got a patient experience community on LinkedIn, which you can join if you ask further questions. I'd like to, if you have any questions now, I'd like you to just, point which is your biggest area of challenge out of A, B, C, D. Is it around developing your staff culture survey or measuring it? Is it around analyzing data? Is it about engaging your front line? Is it engaging your front leaders? That's D. Is it identifying the right improvement actions, or is it implementing improvement solutions? Or finally, is it around sustaining that cultural change? Feel free to just pop that in, or alternatively, if you have any questions, I'll stop here and feel free to post questions in the inbox as well, and I'm happy to take any questions that you have now as well. So whilst you're doing that, it's either A, B, C, D, E, F, G. Type that in. If you'd like to talk to us any further, I'll skip this piece here. We do have a whole range of services around cultural improvement and patient experience improvement, and we've been helping many organizations in this space, but feel free to reach out to anyone in the team. Here's some email addresses for you. And in the meantime, I'd love to kind of see if you have any questions in there. Olivia has also typed in a link that you can link in with, but here's some email addresses as well. So Tracy has mentioned the need to identifying the right improvement actions can be a real challenge, and that's really interesting, Tracy. certainly I'll answer that in two ways. If that's a challenge for you, then one of the ways to actually identify the right improvement actions is to work with your team, your staff members, and actually have a brainstorming session around what we think might be the right improvement actions. And when you do that brainstorming, you don't have to worry necessarily about getting it right, but actually testing and experimenting, as I talked about earlier. So that's one of the ways to do it. The other way is we've got a whole solution library of improvement actions. So there's a tool that we have called the Patient Experience Maturity Model, which actually gives you a whole range of actions for different kinds of problems as well. So if you'd like to know more about that, please feel free to just email either myself, Sharon, who's our patient experience specialist, or anyone else from the team as well. So if there are any other questions, please feel free to type them in as well. There's 2 minutes left to go. But certainly, that is a key area of challenge for many people as well. So it is a common one, Tracy, that many people experience. So I'm just conscious of time. If there are no other sort of further questions, we are just coming close to the hour. So thank you very much for listening in. My saying is, if you live to serve, you love the experience. So keep there, don't give up. And I'm sure that you'll make those improvements, or feel free to reach out to us or anyone in the team to help you out as well. Thank you, David, for the comment. I certainly hope things go well for you as well. And feel free to reach out to myself or Sharon if you have any questions. And I think the recording will be sent out. I believe feel free to share that with your colleagues as well, or reach out to us if you'd like more information. Thanks very much, all the best, and have a great rest of the day. Thank you.